Your vagina is speaking to you, and vaginal discharge is the language. If you ignore your vaginal discharge, you might miss some of the first signs of a serious infection or a health condition. So please pay attention and watch this video till the end. Now, the first one I'm going to talk about is the normal one, which is usually white or milky discharge. Now, this white or milky discharge may change in consistency of when you are ovulating and become a bit stretchy, but it's still very clear or white in color. Now, this normal discharge is very normal. It is how the vagina is helping to keep itself clean and lubricated. So it is a very normal kind of discharge. The smell. People describe the vaginal smell in different ways. People say musky, metallic. However, I think that the vagina smells like us. So, which means the vagina of every person has a specific smell, which might be very unique to you. Although this smell might influence by your kind of diet, what you have eaten can also affect your vaginal smell. But your vagina should not have a strong smell. It should not have a fishy smell. If you suddenly start noticing a fishy or strong smell, it means something is wrong. The next one is thick cottage cheese discharge, which usually suggests a vaginal yeast infection. Now, this can be accompanied by swelling, redness, or itchiness. Oftentimes, how you differentiate a vaginal yeast infection from other kinds of infection is that vaginal yeast infection will rarely have a bad smell, but it's going to be itchy and all other symptoms, but the smell is not going to be as foul smelling as other kind of infections. So that is something to take note of. Yeast infection is very common with women, and it can be affected by our diet, the kind of underwears we are using, use of antibiotics, douching, and all of that. And sometimes it requires a little or no treatment to actually sort it out. Another abnormal vaginal discharge is yellow or green vaginal discharge, especially if it is thick and foul smelling. This kind of discharge would normally suggest that a person may have sexually transmitted diseases like gonorrhea, chlamydia, sometimes trichomoniasis. So that is something to also be watchful for. If you see any discharge that is yellow or green, it is not normal and you should see a doctor. The next one I'm going to talk about is gray vaginal discharge. Gray vaginal discharge may suggest the presence of bacterial vaginosis, and unlike the yeast infection, this is always accompanied by a very foul, fishy smell, which is how you differentiate it from vaginal yeast infection. Bacterial vaginosis happens if there is a disruption in the balance of the vagina. This can be caused by frequent use of antibiotics, douching. All of those things can actually disrupt the normal pH balance of the vagina and then expose you to infections. Another vaginal discharge that you should not ignore is a foamy or frothy vaginal discharge. This is abnormal and it usually suggests that someone may have trichomoniasis. This can be accompanied by a bad, unpleasant smell. It can also be accompanied by itching or burning sensation. This is a sexually transmitted disease, and if you notice this kind of discharge, the best thing is to see a doctor for proper diagnosis and for treatment. Sexually transmitted diseases are not something that you should actually ignore. They are things that you should have it checked out, diagnose, treat it, and also do a post-treatment test to make sure that you've been cleared of it. Because some of these infections, they kind of linger in the body. I'm telling you, years and years, they stay in the body and they are causing problems, especially with women. It can cause infertility if you have an untreated sexually transmitted disease. So if you notice anything that is off, make sure you are checking it out. Make sure you are getting the treatment that you need. Another vaginal discharge is brown or bloody vaginal discharge. You might notice a bit of brown spotting before your actual period or a few days after your period. This is still part of your period blood that is leaving your body. So this can be considered normal if you see it within this period, maybe a few hours or days before your period or days after your period. However, if you start seeing this kind of discharge in between your period, you're not menstruating, and then you start seeing this kind of discharge when you are not menstruating, then it is a concern. It can be a sign of bleeding. It can just be anything. It is not normal and you have to check it out. So brown bloody discharge anywhere outside your menstrual period is not normal. So to conclude this video, I'm going to advise you to pay close attention to your vaginal discharge. That is how your body is telling you if there's anything wrong with any of your reproductive organs. So pay attention to the consistency, pay attention to the smell, the quantity, the color All of these things is something that you should report if you notice any change at all, and then you get the appropriate treatment on time. Also, you should know that your vagina is not supposed to smell like perfume. It's not supposed to smell like flower. It's supposed to smell like you. So please don't try too hard to make it smell so good that you end up exposing yourself to infections. Thank you guys for watching this video. I would really like to read your comment and see what you think. If this video was helpful for you, please make sure you share it, and also please subscribe to my channel. Thank you guys. Bye bye.